Many men assume that if everything seems normal down there, then no special care is needed. But the truth is, most men don't realize that small daily habits or the lack of them can quietly affect penile health over the years. Things like skin changes, sensitivity, circulation, and even tissue quality don't usually cause problems immediately. They develop slowly, and by the time a man notices something is different, preventable damage may have already happened. If you've ever wondered whether you're actually taking proper care of this part of your body, this video is for you. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. Today, we're going to talk about 5 essential care practices that every man should know and that can make a real difference in the long term. The penis is not just one type of tissue. It's made of skin, blood, vessels, nerves, and specialized structures like the corpus cavernosum, which fills with blood during an erection. All of these depend on good circulation, healthy nerve function, and proper skin integrity. As men age, especially after 40, blood flow can naturally decrease. Skin elasticity may reduce. Sensitivity can change. Lifestyle factors like smoking, diabetes, high blood pressure, and obesity can accelerate these changes. But many men don't realize that daily hygiene, physical activity, and even how you handle the area during cleaning or intimacy can also impact long-term health. This isn't about vanity, it's about prevention, function, and quality of life. Let's go through the 5 essential care tips, one by one. The first important point is proper daily hygiene, especially for uncircumcised men. If you're uncircumcised, the foreskin creates a natural fold where moisture, sweat, and dead skin cells can accumulate. This buildup is called smegma. In small amounts, it's normal. But if it's not cleaned regularly, it can lead to irritation, unpleasant odor, and even infection. Conditions like balanitis, which is inflammation of the glands, are more common when hygiene is neglected. The solution is simple. During your daily shower, gently retract the foreskin and wash the area with warm water. You don't need harsh soaps or chemical products. In fact, strong soaps can irritate sensitive skin and disrupt the natural balance. Plain water, or a very mild soap if needed, is enough. Even circumcised men should clean the area properly. Sweat and bacteria don't discriminate. This small daily habit can prevent infections, discomfort, and conditions that may require medical treatment later in life. The second important point is avoiding tight clothing and allowing proper air circulation. Wearing tight underwear or pants for long periods increases heat and moisture around the genital area. This creates an environment where fungal infections and skin irritation are more likely to develop. Constant pressure can also affect comfort and, over time, circulation. Some studies suggest that chronic heat exposure in the groin area may even impact sperm quality, which is important for men who are trying to conceive. Choose breathable fabrics like cotton. Avoid spending the entire day in tight jeans or synthetic athletic wear, especially in hot and humid climates. At night, consider loose-fitting clothing or sleeping without tight underwear. It's a small change, but it allows the skin to breathe and reduces the risk of irritation and infection. The third important point is maintaining a healthy body weight and staying physically active. Excess body fat, especially around the abdomen, is strongly linked to poor blood circulation. The blood vessels that supply the penis are small. Any condition that affects vascular health like obesity or high cholesterol can reduce blood flow. Over time, this may contribute to erectile difficulties. Physical activity improves circulation, supports cardiovascular health, and helps maintain hormonal balance, including testosterone. You don't need to become an athlete. Even 30 minutes of walking, cycling, or light exercise most days of the week can make a meaningful difference. Weight management also reduces the risk of diabetes and high blood pressure, 2 major factors that affect erectile function and overall penile health. This is prevention that starts from the inside. The fourth important point is being gentle during sexual activity and self-stimulation. The penis contains delicate structures. Rough handling, aggressive techniques, or using objects not designed for the body can cause micro-injuries, bruising, or more serious damage. One condition called Peyronie's disease involves scar tissue forming inside the penis, often after repeated minor trauma. This can lead to curvature, pain, and difficulty with erections. Whether during intimacy or self-stimulation, be mindful of force and positioning. Use appropriate lubrication when needed. It reduces friction and protects the skin. If you ever notice unusual pain, swelling, bruising, or changes in shape after sexual activity, don't ignore it. These can be signs of injury that should be evaluated by a doctor. Being gentle and attentive is not weakness. It's intelligent self-care. The fifth and final point is paying attention to changes and not ignoring warning signs. Many men avoid talking about genital health, even with doctors. But early detection of problems can prevent complications. If you notice persistent redness, itching, or rash, lumps or unusual growths, pain during urination or erection, abnormal discharge, changes in skin color or texture, or erectile difficulties that don't improve, it's worth scheduling a consultation. These symptoms don't always mean something serious, but they should never be ignored. Infections, skin conditions, hormonal imbalances, and other issues are much easier to treat when caught early. Your urologist is there to help, not to judge. Now, I want to be very clear about something. Every man's body is different. What works for one person may not be ideal for another, especially if you have underlying health conditions. These tips are general preventive care, not a medical diagnosis or treatment. If you're experiencing symptoms, discomfort, or concerns, consult a qualified healthcare professional. Self-care is important, but professional care is irreplaceable. So, here's my question for you. How many of these 5 care practices are you already following? And is there one you think you should start paying more attention to? Leave a comment below. I read them, and your questions often inspire future videos. If this video helped you understand something new about your health, consider subscribing to the channel. I post new content every week about men's health, urology, and prevention explained clearly, honestly, and responsibly. Take care of your body. It's the only one you have. I'm Dr. Ananya Rao. I'll see you in the next video.